Hey there, and welcome to your NCLEX-RN preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Let us see a case study. Mr. Segres, a 65-year-old male with a history of high blood pressure and diabetes, was admitted to the hospital due to confusion, muscle weakness, and seizures. He had been taking diuretic medications for several months, which likely contributed to his current condition. On admission, his blood pressure was low at 90/60 mmHg and his pulse was weak. Laboratory tests revealed hyponatremia, or low sodium, with a sodium level of 125 milliequivalent per liter, and hypokalemia, or low potassium, with a potassium level of 3.2 milliequivalent per liter. The physician ordered sodium chloride, IV infusions, monitoring of electrolyte levels, a reduction in the dose of diuretic medication, and dietary sodium restriction to address his electrolyte imbalances. What is the most likely cause of the patient's confusion, muscle weakness, and seizures? The options given to you for this question on the screen are Option A, hypertension. Option B, diabetes mellitus. Option C, hyponatremia. Option D, hypokalemia. Option E, diuretic medication. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct options are Option C, or hyponatremia, and Option D, or hypokalemia. Hyponatremia, or low sodium levels, is noted in the patient's lab values. Here it is 125 milliequivalent per liter. Symptoms of hyponatremia include confusion, muscle weakness, and seizures, which are also present in the patient. Hypokalemia, or low potassium levels, is also noted in the patient's lab values. Here it is 3.2 milliequivalent per liter and can cause similar symptoms. Hypertension and diabetes mellitus are present in the patient's past medical history, but are not the immediate cause of the symptoms. The diuretic medication the patient was on may have contributed to the low electrolyte levels, which is why the physician ordered to reduce the dose of the medication and monitor electrolyte levels. However, the main cause is the low sodium and potassium levels. Let us see another question for more practice. If you're watching this video and feeling the pressure of tackling those challenging NCLEX-RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX-RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, This book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX-RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. What is the most likely cause of the patient's hyponatremia and hypokalemia? The options given to you for this question on the screen are: Option A, excessive fluid intake. Option B, increased use of diuretics. Option C, kidney disease. Option D, medication side effect. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The right answer is option B, or increased use of diuretics. The patient is admitted with symptoms of confusion, muscle weakness, and seizures and has a low blood pressure and weak pulse. The patient has a history of hypertension and diabetes and is on diuretic medication. The sodium level is low, or 125 milliequivalent per liter, and the potassium level is also low, or 3.2 milliequivalent per liter. The physician has ordered a reduction in the dose of diuretic medication and a dietary restriction of sodium. These factors suggest that the increased use of diuretics is the most likely cause of the patient's hyponatremia and hypokalemia. Option A, or excessive fluid intake, is not likely since the patient has a low blood pressure and is being monitored for electrolyte levels. Option C, or kidney disease, may also contribute, but the focus is on reducing the dose of diuretics and dietary restrictions of sodium. Option D, or medication side effect, is also a possibility, but the focus is on the patient's use of diuretics. Let us see another question for more practice. What is the correct nursing intervention for the patient with hyponatremia and hypokalemia as noted in the scenario? The options given to you for this question on the screen are: Option A, stop sodium chloride, IV infusion. Option B, increased dose of diuretic medication. Option C, no dietary restriction of sodium. Option D, monitor fluid intake and output. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option D, or monitor fluid intake and output. Option A, stopping the sodium chloride IV infusion would be detrimental to the patient as they are suffering from hyponatremia, which is a low level of sodium in the blood. Sodium chloride infusion is necessary to replenish the sodium levels. Option B, increasing the dose of diuretic medication would further lower the potassium levels, as diuretics increase urine output and can result in the loss of potassium and other electrolytes. Option C, no dietary restriction of sodium, would not be appropriate as the patient is already suffering from hyponatremia, which could be due to excessive sodium intake. The dietary restriction of sodium is necessary to regulate sodium levels. Option D, monitoring fluid intake and output is important to ensure that the patient is not retaining excess fluid and electrolytes. This will help to regulate the electrolyte levels and prevent further fluctuations. Let us see another question for more practice. What nursing intervention should be taken for the patient's electrolyte imbalances? The options given to you for this question on the screen are: Option A, increase the dose of diuretic medication. Option B, stop sodium chloride IV infusions. Option C, remove dietary restriction of sodium. Option D, monitor electrolyte levels. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option D, monitor electrolyte levels. The physician has already ordered the appropriate interventions for the patient's electrolyte imbalances, including sodium chloride IV infusion, reducing the dose of diuretic medication, and dietary restriction of sodium. The most important intervention at this point is to monitor the patient's electrolyte levels to ensure they are improving and within normal range. Option A is incorrect because increasing the dose of diuretic medication may worsen the patient's hyponatremia and hypokalemia. Option B is incorrect because stopping the sodium chloride IV infusions may result in further decline of the patient's sodium levels. Option C is incorrect because removing the dietary restriction of sodium may lead to further imbalances in the patient's electrolyte levels. Let us see another question for more practice. What is the nursing intervention for hyponatremia? The options given to you for this question on the screen are: Option A, provide sodium chloride IV infusions. Option B, provide osmotic diuretics. Option C, choose hormone replacement procedure. Option D, reduce the dose of diuretics. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct option is A. Provide sodium chloride IV infusions. If hyponatremia is due to fluid or blood loss, vomiting, or diarrhea, the nursing intervention would be to provide sodium chloride IV infusions. Option B is not correct as osmotic diuretics are used in case of excess fluid volume and not in case of hyponatremia. Option C is incorrect as it is only applicable if the cause is Addison's disease. Option D is correct only if the cause of hyponatremia is due to certain medications, such as diuretics. Let us see another question for more practice. What is the nursing intervention for hypokalemia? The options given to you for this question on the screen are: Option A, provide sodium chloride IV infusions. Option B, administer diuretics. Option C, supplement dietary potassium sources. Option D, reduce the dose of drugs causing hypokalemia. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct option is C, supplement dietary potassium sources. Option A is incorrect as hypokalemia is not caused by fluid or blood loss and does not require sodium chloride IV infusions. Option B is incorrect as the use of diuretics may further deplete potassium levels. Option D is incorrect as reducing the dose of drugs causing hypokalemia may not be enough to treat the condition and may require additional interventions. Option C is correct as supplementing dietary potassium sources such as bananas, spinach, or other green leafy vegetables can help to raise potassium levels in cases of moderately low potassium levels. However, severe hypokalemic states may require supplemental potassium. Let us see another question for more practice. Mrs. Anita is a 65-year-old female with a history of high blood pressure and type 2 diabetes. She was recently hospitalized due to dehydration and low sodium levels. Her sodium levels were measured to be 125 milliequivalent per liter. The nurse administers a sodium chloride IV infusion and monitors her vital signs closely. Mrs. Anita experiences no adverse reactions and her sodium levels return to normal range after the infusion. What is the normal range for sodium levels in the body? The options given to you for this question on the screen are: Option A, 125 to 135 milliequivalent per liter. Option B, 135 to 145 milliequivalent per liter. Option C, 145 to 155 milliequivalent per liter. Option D, 155 to 165 milliequivalent per liter. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is B, or 135 to 145 milliequivalent per liter. The normal range for sodium levels in the body is 135 to 145 milliequivalent per liter. This is necessary for the body to conduct nerve impulses, contract and relax muscles, and maintain the proper balance of water and minerals. Mrs. Anita's sodium levels were measured to be 125 milliequivalent per liter, which is below the normal range. This is a condition known as hyponatremia and can cause symptoms such as seizures, nausea, confusion, restlessness, muscle weakness, and fatigue. In order to correct this, the nurse administered a sodium chloride IV infusion, which helped to bring Mrs. Anita's sodium levels back to the normal range. Let us see another question for more practice. Mrs. Anita is a 65-year-old woman with a history of kidney disease and hypertension. She has been experiencing symptoms of fatigue, muscle weakness, and irregular heartbeat. Upon examination, it is found that Mrs. Anita's potassium levels are low at 2.8 milliequivalent per liter. What is the most likely cause of Mrs. Anita's low potassium levels? The options given to you for this question on the screen are Option A, excessive potassium intake in diet. Option B, strong physical activity and exercise. Option C, chronic kidney disease and use of certain medications such as diuretics. Option D, exposure to heat and dehydration. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. Correct answer, C. The most likely cause of Mrs. Anita's low potassium levels is chronic kidney disease and use of certain medications, such as diuretics, as these can lead to decreased potassium excretion. Excessive potassium intake in diet and strong physical activity and exercise would not typically cause low potassium levels, and exposure to heat and dehydration can cause high potassium levels rather than low. It is important to maintain proper potassium levels in the body as it helps with various bodily functions, including fluid balance and regulation of muscle contractions and electrical impulses. Chronic kidney disease and use of certain medications, such as diuretics, can lead to decreased potassium excretion and result in low potassium levels. It is important for healthcare professionals to identify and address the cause of abnormal potassium levels in order to properly treat the condition. Let us see another question for more practice. A 43-year-old male patient, Berman, has been admitted to the hospital for dehydration due to diarrhea. The nurse checks his vital signs and notices that his sodium level is low at 130 milliequivalent per liter. The nurse also notes that Berman has a history of using diuretics for hypertension. What is the most appropriate nursing intervention for Berman's low sodium levels? The options given to you for this question on the screen are Option A, administer osmotic diuretics. Option B, administer non-osmotic diuretics. Option C, provide sodium chloride IV infusions. Option D, reduce the dose of Berman's diuretics. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is C. Provide sodium chloride IV infusions. The nurse should provide sodium chloride IV infusions to Berman as his low sodium levels are due to fluid loss from diarrhea. Osmotic diuretics would not be appropriate as they are used for excess fluid volume, and non-osmotic diuretics would only further promote sodium excretion. Reducing the dose of Berman's diuretics may not be enough to correct his low sodium levels. Let us see another question for more practice. Mrs. Prasanna is a 65-year-old female with a history of hypertension and type 2 diabetes. She was admitted to the hospital for uncontrolled blood sugar levels and dehydration. During her stay, the nursing staff noticed that her sodium levels were consistently low and her potassium levels were consistently high. The nursing staff implemented a low-sodium diet and administered diuretics to help decrease the potassium levels. However, Mrs. Prasanna's electrolyte levels remained abnormal despite these interventions. Further investigation revealed that Mrs. Prasanna had been taking a potassium-sparing diuretic for her hypertension without realizing the potential for electrolyte imbalances. What is the most likely cause of Mrs. Prasanna's abnormal electrolyte levels? The options given to you for this question on the screen are Option A, a low-sodium diet. Option B, a high-potassium diet. Option C, the use of diuretics. Option D, a history of type 2 diabetes. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is C. The most likely cause of Mrs. Prasanna's abnormal electrolyte levels is the use of diuretics, specifically a potassium-sparing diuretic. While Mrs. Prasanna's low sodium levels and high potassium levels may have been exacerbated by a low sodium diet and uncontrolled diabetes, the use of a potassium-sparing diuretic would have contributed to the abnormal levels by preventing the excretion of potassium in the urine. Let us see another question for more practice. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX-RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Kiara is a 63-year-old woman who has been experiencing muscle weakness, fatigue, and seizures. Upon examination, her sodium levels were found to be 125 milliequivalent per liter. She has a history of heart disease and is currently taking loop diuretics per her congestive heart failure. What is the most likely cause of Mrs. Kiara's hyponatremia? The options given to you for this question on the screen are Option A, high sodium intake in diet. Option B, high level of sodium excretion due to diarrhea. Option C, low sodium intake or sodium reabsorption in kidney disease. Option D, Use of loop diuretics. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is D. Mrs. Kiera's hyponatremia is likely caused by her use of loop diuretics, which promotes sodium excretion. Option A is incorrect because there is no mention of high sodium intake in the case study. Option B is incorrect because there is no mention of diarrhea in the case study. Option C is incorrect because there is no mention of kidney disease in the case study. Loop diuretics, such as the ones Mrs. Kiera is taking, can cause hyponatremia by promoting the excretion of sodium and water from the body. Other causes of hyponatremia include high levels of sodium excretion due to diarrhea, vomiting, or diuresis, low sodium intake or reabsorption in kidney disease, and certain medications and diseases such as Addison's disease and hypothyroidism. It is important for healthcare providers to carefully monitor electrolyte levels and adjust treatment accordingly in order to prevent imbalances and complications. Let us see another question for more practice. Mr. A is a 40-year-old male who has been experiencing symptoms of fatigue, muscle weakness, and irregular heartbeat. His blood work reveals that he has hypokalemia with a potassium level of 2.8 milliequivalent per liter. The patient has a history of diarrhea and has been taking loop diuretics for his hypertension. He has also been experiencing nausea and vomiting for the past few days. Which of the following is not a cause of hypokalemia? The options given to you for this question on the screen are Option A, high levels of sodium excretion. Option B, low sodium intake or sodium reabsorption in kidney diseases. Option C, Addison's disease. Option D, increased physical activity. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is D, or increased physical activity. Increased physical activity is not a cause of hypokalemia. Causes of hypokalemia include high levels of sodium excretion due to diarrhea, diuresis, or excessive diaphoresis, low sodium intake or sodium reabsorption in kidney diseases, Addison's disease, and certain medications like loop diuretics, which reject sodium and water from the body. Let us see another question for more practice. Mrs. Kiera is a 63-year-old woman with a history of high blood pressure and heart disease. She has been prescribed diuretics for the past year to help control her blood pressure. Recently, Mrs. Kiera has been experiencing symptoms such as muscle weakness, fatigue, and confusion. Upon admission to the hospital, her laboratory results show a sodium level of 128 milliequivalent per liter and a potassium level of 2.5 milliequivalent per liter. Which of the following is the most appropriate nursing intervention for Mrs. Kiera's hyponatremia and hypokalemia? The options given to you for this question on the screen are: Option A, administering diuretics. Option B, providing sodium chloride IV infusions. Option C, reducing the dose or eliminating the use of diuretics. Option D, providing osmotic diuretics. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option number C. Mrs. Kiera's hyponatremia and hypokalemia are likely due to the use of diuretics, which promote the excretion of sodium and potassium from the body. The most appropriate nursing intervention in this case would be to reduce the dose or eliminate the use of diuretics in order to allow Mrs. Kiera's electrolyte levels to return to normal. Administering diuretics or providing sodium chloride IV infusions would only further exacerbate the electrolyte imbalances, while providing osmotic diuretics would not be effective in increasing sodium excretion. Let us see another question for more practice. Mrs. Kiera is a 65-year-old woman with a history of hyperparathyroidism. She presents to the hospital with complaints of weakness and fatigue. Upon examination, her serum calcium levels are found to be 12.5 milligram per deciliter. What is the most likely diagnosis for Mrs. Kiera? The options given to you for this question on the screen are: Option A, hypocalcemia. Option B, hypercalcemia. Option C, hypomagnesemia. Option D, hypermagnesemia. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option B, or hypercalcemia. The normal range for serum calcium levels is 9 to 10.5 milligram per deciliter. Mrs. Kiera's serum calcium levels are found to be 12.5 milligram per deciliter, which is above the normal range. This indicates a diagnosis of hypercalcemia. Hypercalcemia is characterized by an excess of calcium in the blood, typically due to an underlying medical condition such as hyperparathyroidism or hyperthyroidism. Mrs. Kiera's history of hyperparathyroidism is a known risk factor for hypercalcemia, further supporting the diagnosis. Hypocalcemia, hypomagnesemia, and hypermagnesemia are all characterized by abnormal levels of electrolytes, but they do not fit the given presentation of Mrs. Kiera's symptoms and laboratory values. Let us see another question for more practice. Mrs. Anita is a 61-year-old woman with a history of hypertension and hyperthyroidism. She was recently admitted to the hospital with symptoms of weakness, tremors, and palpitations. Upon examination, the healthcare team found that Mrs. Anita's serum calcium level was 12.5 milligram per deciliter. What is the most likely diagnosis for Mrs. Anita based on her serum calcium level? The options given to you for this question on the screen are Option A, hypocalcemia. Option B, hypercalcemia. Option C, hypomagnesemia. Option D, hypermagnesemia. Take your time to go through the question and each of these options. The timer starts on top right corner of the screen, but if you need more time, you can pause the screen as well. All right, let me reveal the right answer to you. The correct answer is option B, or hypercalcemia. Mrs. Anita's serum calcium level of 12.5 milligram per deciliter is above the normal range of 9 to 10.5 milligram per deciliter, indicating a diagnosis of hypercalcemia. The causes of hypercalcemia may include hyperparathyroidism, hyperthyroidism, certain kidney diseases, or certain drugs, such as glucocorticoids or lithium. The other options, option A, or hypocalcemia, option C, or hypomagnesemia, and option D, or hypermagnesemia, are all incorrect because they refer to low levels of calcium, magnesium, and magnesium, respectively. Mrs. Anita's serum calcium level is elevated, not low, indicating hypercalcemia.